Back to my YouTube channel, Medtastic Days. In this video, I'll be talking about VIVAs, how to prepare for them, and how to maintain your nerves when you don't have an answer to a question. So what are VIVAs? They're essentially oral exams, and they test your ability to define and recall concepts. And yes, they're a bit overwhelming at first, but trust me, they are not as scary as you probably think them to be. They are taken after your theory exams, and they are an important component of your grade, but please bear in mind, most people actually use their VIVAs to bump their grade up, not to lower it. So make sure to take advantage of this opportunity and and study well for it. So the way a VIVA works really is you have a room with a bunch of tables and profs sitting at them, and at those tables and stations, there are questions that you'll be asked orally, and you'll have to answer them. And you go from station to station, and usually each station is either a subject or whatever it is. And sometimes it could be for all modules at once. Some modules semester-wise. It differs for different universities. So, in my university, it was very semester-based system. So that VIVAs for modules of semester one were taken all in one day, and it's very short. You are timed for 5 minutes, and you can answer as many questions as you want in those 5 minutes. So it really depends on your ability to answer questions. It also depends on your speed and how well you know a concept, because sometimes it's better to spend time and talk more about something that you are well versed about, rather than to answer as many questions as possible. They do have a certain number of questions, so once you're done with those questions, they can't ask you anything more than that. So if you want to do that, you can also do that. I have had it done before that. I've kind of answered all the questions at a station before 5 minutes were even over. So yeah, not very conceptual, I would say. Some profs are very conceptual with it, but most, I would say, just require you to know the basics and basic definitions. And so one thing that I like to tell everyone before preparing for your VIVA is know what the stations are. What are you being tested on? What subjects what subjects are more important? So for CVS, biochemistry was something that definitely had a station, but maybe not for RESPO. So things like that. Just be aware of what stations there are, and just study using past papers. That's what I harp in every one of my videos, is past papers are the gold. So there will be questions, very silly questions that sometimes they ask at VIVAs, that aren't really sometimes even a part of your curriculum, and it's best to look at past papers to see what the answers for those are. And one thing that I want to emphasize is the way you study for this is really vocalizing. So making sure you read something, okay, lipoprotein lipase, defining that in words and saying it over and over again, because the more you practice with that, the better you'll actually be able to recall it when you're sitting there and a professor asks you that question. So the way I did it with a study partner, and what we did was I took on some subjects and she took on some subjects. I was the expert in, maybe biochemistry and physio for a certain module, and she in other subjects. And what we did was we basically asked each other questions on the subjects that we were experts at, and helped each other fine tune our answers, or how we could be more concise with them. So these are just some tips I'm giving, and this was really the most effective way because it was actually really engaging. It wasn't as boring, but you should still take that time to do some of the questions yourself, as well, and say them aloud over and over again. Very high yield topics are what you should be focusing on. So don't focus on irrelevant things that aren't usually tested on VIVAs. So once you see the past paper questions, you'll get an idea of what's tested. The other thing I would say is don't be too nervous. Just be confident with your knowledge on the day of. You've studied and you know what you're doing, so don't be nervous. It's actually a very smooth progress. It's not as bad as people put it out to be. And one thing I would say is dress well, remain calm. And the biggest tip I would give is past questions that you don't know the answer to. These are questions that you are absolutely unsure about. There is no point in spending time sitting there thinking about a question that you don't know the answer two. And these are the ones that I'm saying that you absolutely don't know, not the ones that you're not able to recall. For those questions, you should always tell them you'll either answer it in the end, or you can take a deep breath in that moment and try to recall it. But usually people like to say, oh, I'll answer that question in the end. So what are the questions really like? It's most of it, 90% of it is, I would say, very basic definitions. However, for the latter, there will be some profs that'll test you more conceptually. So for your high yield topics, so for example, brachial plexus injuries, which is very, very important for upper limb, make sure to know the ins and outs of brachial plexus injuries, because that is something very conceptual. And I will tell you, I was very conceptually tested on that topic. So there will be profs that are going to be focused more on concepts rather than your memory. So make sure to cover the high yield topics well. And a little tip is, maybe this correlates with the last slide as well, is don't study irrelevant material. So osteology is usually never tested in VIVAs. I've never had anybody ask me about anything related to osteology. However, brachial plexus injuries are really, really important. Now, this may differ for different universities, so always check your past papers and use those as your main guide. So, yeah, that the one thing I would definitely advise is that the questions that are in those past papers, trust me, they get repeated, so make sure to do them well. And the question pool is usually really small. And yeah, that basically sums up most of what I had to say about VIVAs. Thank you for watching this video, and I hope your VIVAs go really well for you. If you have any questions, make sure to DM or email me, check out my blog, subscribe to the YouTube channel, and yeah, and reach out anytime you need any help. I'm always there for you guys, and hopefully this was helpful, and see you guys next time.